Hello and welcome to our presentation of AEDT 3120U's Assignment 3, Investigating Workplace Learning. Your collaborators are Chiu, Omar Lunan, myself, and Osama Shaikh. What I'd like to do is review our scenario from the previous assignment. Our fictional situation was the Open Door Hospital, which had a staff of over 350 employees and catered to two different major cities that were close to each other. After a major catastrophe between the cities, there was a recommendation to upgrade everybody, medical and non-medical personnel, to an advanced cardiac life support. So the previous training method that we used was formal learning. And that's specifically because medical programs are taught in a more formal manner. And this is because of the large amount and depth of information. You can imagine anatomy and pharmacology, understanding drugs and how to administer them. So there's a lot of in-class as well with formal learning in medicine, and it's because you need a lot of simulation. So whether it's with laboratories, emergency room situations, even surgery situations. So what we decided to do is our alternative training method was informal learning. And our rationale behind it was the ability to have the flexibility in learning and teaching the information for everybody. Because there is an online component, it also makes it easier and more cost effective, which we'll discuss in ROI. As far as options to use medical staff in assisting teaching, that would also save money because we're utilizing internal resources. But also we imagine that because it was a hospital, we had training and lab facilities that we could perform learning and teaching in as well. Now, in terms of supporting technology and the rationale, we thought an intranet and the internet would make sense, but the internet would more be on the onus of the staff. So for the online component, if they were training on their own, it would save the company from having to use their own internet. Now, online material and mannequins, which we were hoping had some sort of response, like some of them do, would be great for use and response for this particular type of CPR training. As mentioned, the online version would save a lot more money, and also creating online learning checkpoints and quizzes for training would help to monitor everyone's completion. Now, also having a database that they can go back and refer to and reread would be ideal. So you wouldn't have to retrain or have people come in to do that again, which in turn affects how much money you're retaining as a business. Now, some of the challenges and successes and issues that we were looking at, particularly the issues and challenges were, let's say that your staff did not all speak English, having to modify it to work for their language, which may also mean that you may have to not only have it reworked, but you may have to have staff to come in and teach the hands-on portion, which would increase cost, affecting your return on investment. You also can't assume that everybody has the internet or can afford the internet access, so that is also a barrier to learning. And accountability for the staff to complete training. If you have a date set and they don't do it, how would you create that accountability? But we thought the greatest and almost immeasurable amount of success as far as the scenario was concerned was the benefit company-wide for having everybody prepared for a disaster. It's always great knowing some kind of self-care or first aid, rather, in terms of helping people in a crisis situation. So having the entire hospital that is able to help reduces the amount of concerns that they have when they reach the hospital. So for example, if someone can stop a life-altering concern or help somebody, it changes their ability to survive. So that changes their ability to stay in the hospital and their stay. Now, return on investments, as we reviewed in class, is the ratio between your net profit and the cost of the investment based on investment resources. And of course, having a higher return on investment is favored by companies because you want to spend little and try to gain the most. And some of these returns are, as we mentioned, immeasurable. So looking at the quality of care, looking at the employee satisfaction, looking at patient satisfaction. These are things that you can't put a monetary value to, but can increase a percentage on productivity and client satisfaction, or patient satisfaction in this case. So within our issues, challenges, and successes with return on investment, we thought, what if the training doesn't work? What if they have the access, but they don't actually participate in the training? And we thought, you know what, if it was successful, if everything did work with the training itself, then looking at informal learning as a more permanent solution to training would probably be a great asset to the company, especially since they had the resources on site. Now, we did crunch some numbers and tried to be as specific as possible with the chart that we had, looking at the ins and outs, looking at what the part-time, the full-time staff, what types of staff, whether it was nurses, doctors, interns, things like that, and tried to put a monetary amount in terms of all the things. And we may have missed a few, but we thought it would make sense. And we can see in this chart that there was a significant difference when using online learning versus in-class learning. So we're even more leaning towards informal learning. Within performance support system and electronic performance support system, we thought that EPSS made a little bit more sense, just because with the electronic perspective or the electronic use, it would increase productivity of the employees and aid them in completing tasks. So some of those tests that you can create to monitor, you can see if there are any concerns, and you can possibly offer support. And our rationale was just really saying, yeah, just overall reducing the long-term costs, knowing that we'd need less resources, and again, the accessibility. If they can do the training off-site, that would allow them to retain the material before coming on-site to do the hands-on. Now, the downside of EPSS, you cannot replace traditional learning. You still have to go through learning something. And medical training, because it requires lots of hands-on, some of these theories still may need to be reinforced, which may make training a little bit longer. But you can find a way to make the learning easier as long as you have the correct curriculum. Now, based on the scenario, some of the questions that we thought we were going to pose was, if you were in this situation, what would you consider a reasonable timeline for facilitators to train all 350 staff members? It's a lot of people. Now, should you expect that some of them may not be trained at all? Is it realistic to think that all 350 people will be trained within a specific time? And how would this affect the overall ROI? If there was a catastrophe, would this actually affect the business and affect people? And what would you deem a reasonable consequence for not doing a mandatory training? So again, if you have to make sure that this is a mandatory training, how would you reinforce it? And what would you anticipate the effect would be if this was a negative impact on the business? So there's a situation, and hopefully we can have a great discussion. Feel free to ask us anything that you like. Thank you very much for listening to our presentation.